patient today asked about olanzapine or Zyprexa. Zyprexa is a second-generation neuroleptic, so it falls in the antipsychotic category of medications in psychiatry. But with that being said, psychosis and treating psychosis is not its only function. And in fact, at particularly low doses, for example, it's frequently used to treat individuals with depression or unipolar depression as well. And it can even be used in depression from bipolar disorder. Zyprexa is a D2 blocker, a dopamine 2 blocker, which also affects some of the serotonin receptors in the central nervous system as well. And that's why it's a second generation neuroleptic. And again, it can be very, very effective in terms of improving someone's mood and reducing hallucinations and delusions in schizophrenia and psychosis. Some of the common side effects of Zyprexa include, unfortunately, weight gain for many individuals, although this doesn't always happen, and it is something that can be monitored. And so if you have severe symptoms, it may be worth doing a trial. And then if you have weight gain, it can always be stopped. So weight gain is certainly a potential side effect. Dry mouth, constipation. There can be metabolic changes. So if you're on Zyprexa, your provider will likely want to monitor certain labs. So they'll be checking your glucose levels or your A1C to make sure that you're not at risk of developing diabetes. They'll check your lipid panel, in particular looking at your triglycerides, so the fat cells in your blood, and also your lipids, looking at LDL cholesterol and other items in that panel. They may also want to check a CBC, your blood cell counts, to make sure that you're not having low neutrophils or changes in your white blood cell counts as well. This medication can be rather sedating, so often it's given at bedtime, and for some individuals, if they're having a great deal of difficulty with sleep as one of the symptoms of the primary illness, that can actually be really helpful. And in addition to that, because it's rather sedating, some people feel pretty tired first thing in the morning when they wake up. It typically resolves with time as you adjust to the medication. And again, Zyprexa is used in various conditions. Typically at higher doses, it's used in schizophrenia and psychotic disorders, but it's not uncommon at all to use very low doses for major depressive disorder to augment a primary antidepressant, or even used in bipolar disorder to bring someone down from a mania or to work to stabilize their mood. There are other serious side effects that are possible with this medication, an increased risk for seizure, which you don't tend to see very often, but if a patient has a history of seizures or is vulnerable to having seizures, you want to be careful about them being on this class of medications. And NMS, neuroleptic malignant syndrome, is a potentially very serious side effect of these medications. And you typically see it if someone is taking multiple antipsychotics at the same time, but it can be rather dangerous. So you want to make sure you talk about this with any provider if you're thinking about going on one of these medications. If you believe this video pertains to you in any way, please be sure to discuss directly with a mental health professional. These videos are informative only and not to be meant as medical advice for anyone out there.